Welcome to Get the Facts. This is the program that provides you with information on government's policies and initiatives. I'm Theodore Henry. Our focus today is on health, colorectal or colon cancer in particular. It's a disease that affects the large intestines or the bowel, and to help us understand the causes, the risk factors, treatments, among other things, is gastroenterologist Dr. Mike Mills. Welcome to the program, Dr. Mills.
Thank you very much, Theodore.
All right, let's jump right into it and get the facts.
Sure.
Give us a brief overview. First and foremost, what is colon cancer? What causes it?
Okay, so you mentioned that colon is a large bowel, the last part of the digestive system.
Right.
That's correct. And cancer is uncontrolled cell growth of any part of the body. So it's uncontrolled cell growth of parts of the colon or large bowel.
Right.
Yes.
Okay. What causes that? It just happens?
There are a number of risk factors. The most common thing that we identify it with is age. So as you get older, you have an increased risk of colon cancer.
Right.
There's also genetic predisposition. So we know that families can have colon cancer predispositions as well.
Like my father,
That's right, grandparents,
Right.
aunts, brothers, sisters, that type of thing.
Okay.
Outside of that, there's some other lifestyle-related changes. So if the diet, for example, is very poor in fiber, that can be a problem. So a low-fiber diet is not a good idea. If there's a history of smoking, that increases your risk as well. A history of eating a lot of processed meat or red meat also increases the chance of colon cancer.
Wow.
Excessive alcohol also increases the risk.
That's a pretty long list.
It is, and then there are a few other things like medical conditions, polyps, for example, small
Yes.
warty growths in the bowel, ulcerative colitis, which is a type of inflammatory
Can
bowel
become?
disease, can also become colon cancer.
Oh, so not a direct one-to-one cause, but can become.
Can become. Not all cases progress that way, but we
Okay.
do know that, for example, maybe about 70% of cases really don't have an identifiable risk factor at all. It's just about 30% where there's a direct kind of genetic link. So all these other factors play a role over time.
We're getting the facts. Now, I noticed in your answer that you did not say men.
Yes, that's right. So colon cancer affects the colon, and colons happen to be in both men and women. So everybody has a colon.
Right.
The digestive system is the same in both genders, and so each is affected equally.
Okay. So you mentioned dietary issues, you mentioned lifestyle, you mentioned age.
Yes.
What age are we looking at here?
Okay, so most commonly above the age of 65, this is where we find that the incidence increases significantly. But we do have identified cases as early as in the late 20s all the way up into the early 90s, for example. So
Wow.
it spans the entire spectrum, even though most of them are going to be above the age of 65.
Okay, so you're looking at, it can happen earlier.
It can
but
happen.
certainly you want to get ahead of this thing, test for it, screen for it
Yes, screening is important.
when you reach a certain age.
That's right.
We're going to talk about screening, but before we get there, I wanted to ask about the symptoms. What should I be wary of, especially when I get to a certain age?
Okay, so it doesn't matter the age. If you have any symptoms at all, you need to get that checked out.
Okay,
It doesn't have to be
yes.
cancer, definitely.
Right.
But the symptoms that we're concerned about would be bleeding, so blood in the stool, for example. That's commonly due to something like hemorrhoids or piles.
Right.
But as you get older, or if it's something which is unusual, then you definitely need to get that checked out because it can be a sign. A
Right.
change in your bowel habit, so that's either constipation or even diarrhea, can be associated with colon cancer as well.
Anything strange about
Anything
your normal?
unusual, abdominal pain, for example. If it's very severe weight loss, change in appetite,
Yes.
depending on where it is. If it's spread outside the colon, it can affect other organs. So you can get symptoms associated with the liver, so jaundice or shortness of breath if it goes to the lung, or even can have seizures if it goes to the brain, or bone pain, for example.
Wow, that's a lot, Dr. Mills. That's a wide.
Yes.
So I'm getting that the advice then really would be, don't self-diagnose.
That's right. It's very important. If you do have a symptom, as I said, it's not likely that it's going to be cancer in most cases, but you do need to get it checked out.
Yes.
Because the earlier you check it out, the better it is for you long term.
You know what is up.
That's right.
All right, so we spoke about the symptoms, but I might see something, or better yet, I'm a proactive young man and I decide to get screened and tested. How do you test for this? What do you do as the doctor?
Okay, so if you have a symptom, then definitely you need to do one of the diagnostic test. For example, a colonoscopy,
Right.
where we pass a camera through the rectum into the large bowel to have a look around to see where the abnormality is coming from, if it's bleeding or otherwise.
Right.
You can also do a CT colonography, which is a special type of CAT scan of the bowel, which looks inside as well. You may also do a barium enema, which is not used for screening, but can definitely identify abnormalities inside the colon, which is a special type of X-ray, for example.
Okay, okay. Now, you mentioned that colonoscopy and the enema, and we're Jamaicans, and we know that especially our Jamaican men might be a little bit askance about that. Could you offer us a little assurance? Is this very invasive?
Okay, colonoscopy it is invasive, there's no doubt about that, because you do have to put the camera inside the rectum.
Right.
And yes, as you mentioned, anything to do with the rectum, people are a little wary about it because they're just not sure. But the test is very comfortable. It's done under sedation.
Right.
So you have to take laxatives before to empty the bowel. And when you come to the facility room, then they will give you medication intravenously to make you sleepy, and then pass the camera through like a telescope into the colon, have a look around, and it takes about 20 minutes of procedure time.
Okay, okay. Doesn't sound so bad.
It's really not so bad.
All right. Let's talk about statistics. Jamaica, I did a bit of research leading up to this interview, and I understand that this particular cancer is one of the, if I'm getting my information right, the third
That's right, yes.
leading cancer-related cause of
Yes,
death.
in both males and females.
Yes.
So in females, number 1, breast, number 2, cervix, number 3, colon. In males, prostate, then lung, and then colon. In terms of incidence, Jamaica Cancer Registry at the University Hospital has documented about 13 to 18 new cases per 100,000 per year. So we do have a moderate incidence of colorectal cancer in the island compared to other countries, and it's something that we do see.
Have the numbers been decreasing, increasing, staying steady?
They've been fairly steady. There's some signaling that maybe in males it might be increasing, and we have a concern as well that in younger individuals it may be increasing as well, but we still need to look at the data in more detail.
I see. Wow, that is a lot so far to process. But I think we can take away from this first part of our conversation how important it is to screen.
Yes, screening is key.
Yeah, especially at a certain age, but before, definitely do the work and get tested.
That's right.
All right, Doc, we are going to take a short break. Our audience, don't go anywhere. We'll be right back. We're talking about colorectal cancer, and we're getting the facts. So stay with us after this break.
The travel pad application was created by the Transport Authority for the protection of the commuting public. Please download the travel pad application on the Google Play Store or the Apple iOS Store. Once you download the application, put in your phone number, register the application under your phone number, and then you'll be able to verify the license plate that you're going in. Once you verify the license plate and the information of the vehicle, you will then be able to share that trip of the vehicle that you're in. And if there is difficulty on the trip, you would then will be able to push a panic button and share your location with others as well. Download the application, give us our feedback at customerservice@ta.org.jn. Don't forget, it's free to download, free to use.
Welcome back to Get the Facts. We are discussing colon cancer with gastroenterologist Dr. Mike Mills. In our first segment, we looked at the causes, the risk factors, symptoms. We looked at a few stats in Jamaica and how it is detected. Now we're going to learn a bit more about, well, we've gone through the figures, so we're going to go into this whole idea of screening that we were discussing. We have to talk about that a bit more, treatment, and Dr. Mills is the expert, so I'll allow him to take us through that bit of information. Dr. Mills, let's start with screening. You mentioned how important it is. Tell us a bit more.
Yeah, so screening is key for a number of conditions, and colon cancer is one of those. So everyone is quite familiar with screening for breast cancer, where you do mammography, cervical cancer, pap smear, prostate cancer, your PSA checks, and rectal exam. For colon cancer, the screening is very preventive because you're looking for polyps, which are the stages before cancer.
Right.
If you can remove the polyps, then you'll prevent the development of cancer.
Ah.
So these screening tests are offered at a specific age, and the age that we're advocating is above the age of 45 in average risk individuals.
Mhm.
So if there's no increased risk from family history or anything like that, then anyone over the age of 45 should try and have one of these screening tests done.
Right.
The screening tests available are a fecal occult blood test, which is basically a stool test looking for blood at a microscopic level.
Right,
You're
right.
not actually seeing blood, but when
I
you send
wouldn't
it to
see
the lab,
it.
exactly, you don't see it.
Right.
But you send to the lab to be tested, and quite commonly people do it as part of their annual executive profile, for example. So that's the first test. The other tests for screening involve colonoscopy, which we mentioned before, which is passing a camera through the rectum into the large bowel. And you're looking for polyps to remove them at the time.
Right.
If there's cancer there, then you get a chance to take a sample, do a biopsy, for example. The screening test is a CT of the colon or CAT scan or CT
Right, you mentioned
colonography,
that.
which we also
Yes.
mentioned, which can also look at the colon to give an idea as to whether there's anything. Now, the thing about the screening test, if you do the blood test for the stool, then you have to do it every year, and it has to be 3 samples to be taken as separate stools to be effective for screening.
So wait, can we dial down on that one a little bit?
Yes.
You're saying it has to be done 3 times.
Yes, 1 sample is not sufficient for screening.
Okay. And what's
If any of those samples does show a trace of blood, then that's significant. You need to do a
Right.
further test like a colonoscopy to see where the blood is coming from.
okay?
But just doing 1 sample of stool for the year for your screening is not sufficient. The
So you-
data has shown that you have to do 3 samples of 3 separate stools to get enough of a sample to actually be representative.
So you would say to me, I go to the doctor's office
Yes.
and we do the first one, and you would say, oh, hey, we see something concerning, and then we would come back in.
No. So if any of them show something, so even if you did the first one and it showed something concerning, you
Right.
don't need to do the other 2.
Oh, okay.
You need to go on to do something more diagnostic, like a colonoscopy, for example,
Ah.
where you can then biopsy and get a better diagnosis.
Okay.
But the stool test is only indicating that there's something wrong in the colon.
Which would
But
then.
then you'd need to go and search to see what that is.
So the treatments, if I'm understanding this correctly, the treatments are escalating. You wouldn't always start.
Well,
with-
these are not treatments. These are diagnostic
The screening,
tests,
yes.
Screening tests. So I wouldn't say that they're escalating. Yes, there are different methods of screening, and some of them are more invasive, for example. So you are free to choose any of the screening options available. There are differences in terms of accessibility, in terms of affordability, and the degree to which anyone is able to access a test in any particular system.
Right.
But outside of that, you definitely need to access one of the tests at the appropriate age.
Right.
Yes.
Okay, understood. No, I mentioned treatment because I feel like I wanted to get there. But before we talk about treatment, how aggressive is colon cancer on average? You mentioned that we can.
Okay, so cancer, no matter where it is always a problem because cells, when they're dividing, they don't like to stop in the organ that they
Keep
start
going,
dividing. They
right.
keep going.
And
the problem
metastasize
is
all over the place.
They will metastasize. That's exactly correct. So they can spread to other organs. And when they do that, depending on where they go, then they may either cause problems locally. So inside the bowel, you can have obstruction or bleeding, which can be quite fatal.
Oh.
It can have spread to the liver, for example, impair the function of the liver, go to the lung or to the brain. So it can be very severe and it can be fatal, just like most cancers.
But you did mention that it can be caught early.
The key thing is catching it early because depending on which stage you catch it, the treatment is more effective and the survival is much better. So stage 1, for example, has a different prognosis from stage 4, which is the final stage.
How many stages are there?
There are 4 stages.
Okay. But stage 1 is where we want to be.
Yes, early. Well, ideally you want to go even before stage 1 where there's a polyp. In
Right.
other words, where you're finding the precursor to the cancer. So
And
you
you
can
remove
remove
that.
that before. But yes, if the cancer is there, you definitely want to find it in stage 1. And you're more likely to do that if you do screening. Because at stage 1, you're not likely to have any symptoms at all.
Right.
So you're not waiting for symptoms to do one of the screening tests. You're doing it at a specific age because it's more likely that something would have started to develop at that point. And because polyps take sometimes up to 10 years to turn into cancer if they're going to, you do have some amount of time to actually find it, remove it, before it becomes a problem.
All right. I do want to underline for our guests, though, that you do have some amount of time does not mean that we should be lax
No,
in
definitely.
our testing. You know, Doc mentioned that you mentioned that we should add it to our yearly checkup.
Yes, so there are different intervals depending on which test you select.
Right.
If you're doing the stool test for blood, that's yearly, and you have to keep it up. If
Okay.
you're doing a colonoscopy, and you do the first one at age 45, for example, then you don't need to do another one for 10 years. So if the colonoscopy is completely normal, it's a 10-year interval.
Right.
If you see something and have to remove it, like a polyp, then we'll bring you back sooner. It could be 3 years, it could be 5 years, depending on the type of polyp. If you're
Understood.
doing a CT of the colon as your screening tool, then that's every 5 years.
Okay.
So there are different intervals depending on which test you choose.
Okay. Let's go to treatment now. You've said a few times, remove it.
Yes.
Talk to me about the treatment options.
Okay, so treatment is heavily dependent on the stage at which the cancer is diagnosed.
Right.
If it's early, so stage 1, for example, then the treatment could be as straightforward as surgery to remove the part of the colon that has a tumor in it. So surgery could be completely curative at that point. As you get more advanced, so stage 2, stage 3, stage 4, then you're talking about a combination of surgery, chemotherapy, and possibly even radiotherapy, depending on where inside the colon or rectum the cancer is.
Could you briefly just distinguish between those two last ones, chemo
Yes, so
and radio?
chemotherapy and radiotherapy are both cancer treatments, but they're a little different. Chemotherapy is medication that's given through the vein, so intravenously, and it helps to destroy tissues that are rapidly growing, like cancers.
Right.
It's not usually very targeted, so it can have a lot of side effects, and that's why people are usually more afraid of chemotherapy. Radiotherapy is using specific types of energy to basically burn the cancer from outside. So it's using a direct radiation beam to burn that area where the cancer is.
Probably more targeted.
It is more targeted, but because of the location, sometimes it can cause extra damage in the area around it as well.
Okay.
So it's usually reserved for rectal cancer, for example. Sometimes that can be radiosensitive, and the types of cancers respond differently to different treatments.
Understood. So where we finished the treatment list, I know I jumped in there for chemo versus
Well, for the
radio.
most part, it's a combination of surgery, chemotherapy, radiotherapy. Sometimes you can do the chemotherapy before the surgery
Right.
to try and get the cancer to go to a smaller size and make the surgery more successful. Or you can do the surgery first and then do the chemotherapy. So those are options that the oncologist or surgeon will discuss with you at the time of treatment, basically.
Understood. Doc, we're almost out of time. I just want to do this last question that gives our viewers direction. Where can we get tested?
Okay, so the key thing is that accessibility is going to be either through your private physician. So, for example, doing the stool test for blood, the fecal occult blood test, is a recommended screening tool.
Yes.
For population level. It's accessible at almost every facility has capability. A colonoscopy can be offered in the private and public settings. The public settings may be a little pressed in terms of doing screening because of the numbers, but it is accessible as well. And then the colonography, which is the CT or CAT scan, can be done, accessed either through your healthcare provider or the public system again.
Understood. All right, Doc, we're all out of time. 10 seconds, your last word to the public. We've gotten the facts. What would you like to leave them with?
Okay, so the key thing is awareness. Certain age, so above 45, a screening test is necessary. There are steps you can take to reduce your risk.
Yes.
So looking at your lifestyle, cutting back on things like smoking, alcohol, make sure that you have a high fiber diet, cut back on obesity, make sure that you know your family history to see if you're at increased risk, and then access one of the screening tests at the appropriate time to have the best outcome.
Awesome. This has been Get the Facts. Our guest was gastroenterologist Dr. Mike Mills. We want to thank you for watching, and until next time, we are reminding you to get screened. Don't wait until it turns into something large. Add it to your yearly routine. I'm Theodore Henry. Take good care.